Welcome all to the Doctor's Talk. I, Dr. Kiran. We have senior most cardiologist of the city, Professor Dr. Dayasagar Rao, with more than 55 years of clinical experience. In 1964, he completed MBBS from Osmania Medical College, and in 1969, FRCP from Royal College of Physicians, Edinburgh, and in 1971, FRCP from Royal College of Physicians, Canada, and in 1975, he did DM cardiology from CMC Vellore and worked there as assistant professor of cardiology till 1978, and then as a professor of cardiology at Osmania Medical College, Hyderabad, and then followed by that HOD cardiology at Durgabai Desmukh Hospital till 2008, then followed by being a senior consultant cardiologist at KIMS Hospital. He has produced number of papers and articles which are read by many doctors throughout the world. He has been a principal investigator for many clinical trials. He is a recognized teacher by the National Board for DNB Cardiology. Most important, he is an intelligent man with a kind heart. I should also say a very strong man. So I welcome you, sir, for this interview meeting at this time of lockdown.
Thank you for inviting me.
During the COVID, we need your advices and blessings for all the doctors and our listeners. So with this, we will go ahead, sir.
Okay.
So you have been an exemplary doctor in all situations. You faced so many situations like this, like pandemic situations you might have come across in the past. So how do you feel that current situation is different from the past, sir?
This kind of what do you call public health problem has not occurred, at least in this part of the country. That is in the southern states, the erstwhile Andhra Pradesh, and the presently in Telangana and Andhra Pradesh. We have never faced this kind of a public health problem. So, just 1 minute. I'll just. Yeah. Sorry?
You can go ahead, sir.
Yeah, okay. I think we never had this kind of a public health problem. And probably this is one time wherein suddenly we realize the lacunae in our healthcare system with little or no emphasis on public health issues like controlling the epidemics and controlling the generalized infections of virus. And unfortunately, as of now, there is no recognized effective medical treatment for this kind of disease. And we are treating the patients empirically and symptomatically. And the best, protection right now is to have what we call social distancing. And for many people, we are advising, including ourselves, to isolate ourselves from the main stream of the society. And as doctors, we are not really used to sitting and for weeks together in the houses. This is almost a third week that we are forced to confine ourselves in the house. And as doctors, very few of us know very little other than the medicine. And that makes things very difficult for us to how to occupy the time. And irrespective of the money, what we get or what we don't get, we feel restless when we don't see the clinical patients, which are challenging our knowledge and our commitment to the patients. So we feel a bit out of place right now, but all the same, in the larger interest of the control of this pandemic, I think we are forced to confine ourselves and set an example to the rest of the public, saying that even people like doctors were supposed to be at the forefront of the diagnosis and treatment, and we are really forced, except those people who are really working with active disease. I feel very, apprehensive about these junior consultants and junior doctors who are working with the patients who are infected or otherwise potentially can cause infection to the healthcare professionals, not only doctors, but also the nurses and the fourth-class employees who are involved in the maintenance of hygiene and sanitation within the hospital. And unfortunately, the way it is, some of the patients are not even revealing their whereabouts in the previous 1 or 2 weeks. And they're not telling whether anybody in the house is sick. And there is a newer problem is most of the middle class families have got some servant maids and servants in the house who take care of our the household chores. And not only we should take care of ourselves and our families, it becomes equally important that people who come into your house are also taken care of. And this is in the best interest of your health. It is in the best interest of your family, because if that person is infected and is hiding it, then we really have a big problem. So the first question I keep asking whenever that servant maid or servants come into my house, is everybody safe? Is everybody healthy in your house? And the first thing I keep telling them is, you please go to the washroom and then wash your hands. And then I give them a surgical mask, ask them to wear it before they even attempt to come into our house and start touching all the things. So this is one of the things, it is in our interest, apart from moral responsibility of taking care of our people who work for us, it is also in the best interest of our health and our family that we advise them properly, and we make sure that they follow the sanitation and hygiene which is expected of them. Be that as it may, I think this pandemic has brought out a lot of problems which have been lying dormant, and which the respective governments of many states have been turning a deaf ear to the representations made by many of the persons working in the healthcare. Suddenly we find that there are not enough beds for acutely ill patients. And suddenly we find that ventilators are not that many. They are only in single digits in each hospital, because we don't expect that many people to fall ill at the same time. Even for a hospital like corporate hospital like Kim's Hospital at Begumpet, we have both intensive cardiac care and intensive medical care, and also all put together probably we have about 20 ventilators. And for those patients, forgetting about the ventilators what they use during anesthesia and post-operative patients. So God forbid if 100 people fall sick at one time, no single hospital will be able to take care of them.
Exactly.
And the scenario is no better in the government hospital. If at all anything, it is much less as compared to corporate hospital, because of financial crunches, because that has not been taken care of. And that is one of the reasons why suddenly we find that the healthcare infrastructure is very, very poor in our country. Not only with respect to the number of doctors per 100,000 population, the doctor number is very, very insignificant as compared to the West. If you say that there are about 15 doctors in USA per every 100,000 people, in India it is only 1 to 2 per 100,000. So that is really, it is now challenging the healthcare system, and it is a point to ponder after we recover from this illness, what should be our aim to produce more basic doctors instead of more super specialists. I think we need to think about family physicians and general practitioners to be more available in every corner of the city, so that they can take care of the patients properly. Suddenly you find that there are not many doctors to take care of the sick people. That's really. And secondly is that our emphasis has been only on the tertiary care. Very little has been looked after for the primary care and secondary care. And as a matter of fact, probably the best way of getting around this problem has been the old saying by the Chinese at one time was, you pay the doctors not by how many sick people you see, but you pay the doctors how many normal people are there within the community in which he is working. So the more the number of normal people or less sick people, the more that doctor should be paid, because he's going to look after the preventive care rather than the therapeutic care.
Right, sir.
So
Well said, sir.
I think our system of payment also should be changed.
Right.
Apart from more emphasis on primary care by way of encouraging health education at the school level, health education at the college level, basic hygiene, personal hygiene, and what we call social hygiene. What are the things you should do? What are the things you should not be doing on the streets, like spitting on the roads? It is very common. So now suddenly we realize that this is so important now. Now we have to introduce a law now to say that if you spit on the road, you'll be penalized. That thing should have been done long ago. That's what was being done in Singapore.
Yeah.
So the same thing has to be done now. Now suddenly you also find that this so-called namaste in our society probably is the result of many what you call previous medical practitioners knowing the importance of distancing oneself from the sick people. Don't shake hands with them. Just you can still respect them by way of namaste, rather than shaking hands and hugging and other thing, which is the Western culture. And we need to realize that this system of namaste, that is respecting the others without touching them, is probably more relevant than ever today.
Yes, sir.
So these old practices which have been inculcated in these, what you call in our country, which has been ridiculed by a lot of people. And people were telling you should shake hands, you should meet with people, you should hug them. Now suddenly you realize that what do you call basic misunderstanding of the basics. I'm sure our previous generations of people about 100, 200 years ago must have gone through a lot of epidemics like plague, cholera, and other things. And then they realized that personal hygiene and keeping away from the patients by way of avoiding physical contact probably has resulted in saying namaste rather than shake hands.
Exactly.
And probably this is one of the things that we need to educate now, probably more than ever now,
Great,
at least
sir.
for the future generations, about health education in schools, health education in colleges, and health education at work also. It is important. Importance of self-hygiene, importance of physical activity, importance of good food. And I think it is time that government also takes a serious note about these fast foods, which are becoming, as a matter of fact, when I was asked to give a talk in one of the schools, now we have schools within the city of Hyderabad, schools without playground, which, which never existed during our time, that is 1950s. Every school had a huge playground and we used to have intervals for play. Not only apart from the lunchtime, you also had a PT class. PT class was basically once in a week, and we had to do exercises and drills and other things. And nowadays, nobody has a PT class in the curriculum of the schools.
Yes.
So we are really planning for a sick society.
Yes,
We're
sir.
only asking the children read and read and read and carry a bag full of books. And when they come home, they are just only playing electronic games.
Exactly.
And parents are also not encouraging them to go out and then play. And unfortunately, as it is, we do not have any playgrounds also in and around most of the colonies. So basically now this has, the silver lining of this pandemic is a re-emphasis on personal hygiene and social hygiene, importance of what do you call the sanitation, not only in your house, but around your house, and take care of the society. Your responsibility is not only with you and your family, but also to the society.
Exactly, sir.
If you
Very well said.
participate that way, probably you'll be doing a great service. Coming back to this pandemic of virus infection, as on today, no recognized or established drug is there which has really changed the outcomes of the patients. There have been a lot of controversy about usage of anti-malarial drug, chloroquine and hydroxychloroquine. And ICMR Indian Council of Medical Research has given, probably rightfully, the preventive dosages of hydroxychloroquine, prevention of COVID virus infection. There is no data as such, but extrapolating from the basic sciences, they have said that you take this medicine 400 milligrams twice daily for about 1 day, followed by 400 milligrams once daily, once in a week for the next 7 weeks. In my opinion, I think that's fair enough. It is remarkably safe drug, although people say that it does increase the QT interval and then the predisposition to ventricular tachyarrhythmias if the QTC gets prolonged. But remember that we have been giving chloroquine for rheumatoid arthritis patients for decades. And nobody complained of that event. And it's very unusual, unless you're taking other drugs which can also prolong the QTC. This drug is fairly safe. Be that as it may, pending the availability or pending the the practical utility of a vaccine against this virus, as things stand today, we need to have some basic precautions, both for doctors as well as patients. First thing is social distancing. That is, not to come very close to each other, maintain a respectable distance of 1 meter, that is 3 feet. That means actually, if you say simplest is to keep yourself away at arm's distance. That is the simplest way of putting it. So that, your arms, especially in adults, I'm sure it goes beyond 1 meter. Second thing is, when you're going out, probably you need to wear a mask. There are a lot of discussion about, one of the simplest thing, actually, if you see the pandemic, incidence of the disease in various countries, there was a, video recording from one lady from Czechoslovakia. It looks as though Czechoslovakia in the Europe has got the least incidence of COVID virus. And do you know what is the reason? Right from the first day, they said they have put the lockdown and everybody is asked to wear a mask. Wear a mask, not necessarily made by the so-called N95. They said even cloth masks are fairly protective. It may not protect 95%, which N95 is supposed to do it, but it will protect at least 50%. And their argument is some protection is better than no protection. So instead of crying and saying that masks are not available, even in USA where my daughters live there, she was telling that people have been donating some cloths by the various shops, various marketing places for people to make their masks at the house.
Their own masks.
Now here, that is the status in USA, mind you. Now here people are complaining there are no masks. But as Indians, we know how to get around the problem. People have been wearing these handkerchiefs across the nose and other things. That's fairly good enough, provided you clean the kerchief every day. So basically, I think wearing a mask and social distancing and hand wash. You don't require alcohol-based sanitizers. It's quite expensive. It is not that, most of the doctors can afford it. We have been using it almost daily, because whenever we go and see a patient, there is a sanitizer at the foot end of the bed, and we really clean our hands. But for a household, plain simple water and soap. You have to rub to get a foam. A nurgocharaga. You have to rub it and then keep it like that for about 1 minute. People say it is 20 seconds. It is 20 seconds is, you really don't know when to stop it. But I said, you rub it long enough for it to get a lather and keep it not only in your hands, but also up to the distal 1/3 of the distal area of the forearm. And then wash it with the plain water. And then don't touch things unless it's an absolute necessity. So these are all the important things that one can take care of it. But as I said earlier, you should not only do it yourself and request your family members to do it, but you should insist that all the servants or people who walk in do the same thing in the house. If you are doing it and people walking in are not doing it, you're not protecting yourself completely. This is one of the things. Now, coming to advice to patients, because patients have been calling us up saying that, sir, can we come for a checkup because you asked us to come after 2 months. Now, today is the end of almost 2 months. I want to come tomorrow. I keep telling them, please don't visit the hospital for routine checkups, like measurement of blood pressure, adjusting with the medicines, all these things. I said, if you are not feeling unwell, if you are feeling okay, continue the same medicine, the same dosage, the way it is. Probably you can do it better now than before because you're staying in the house and you can see the clock and then take medicines. It is an opportunity for you to have a better control of the disease. Don't lose this opportunity because you can go and take it and then see the difference to yourself. Second thing is, since you have got all the time in the world by staying in the house, you should do regular walking within the house. Walking should be done preferably in the fasting state. And do a brisk walking within the house, I'm sure most of the houses have got long verandas or some long open space within the house. But you should walk alone. Don't carry your friends along with you. Because their friends may not mean anything wrong to you, but inadvertently you can catch the infection should they have any, what we call asymptomatic disease. So you walk alone, walk briskly, non-stop for half an hour. And take medicines by clock. This is the time wherein you can control your diseases better, especially your blood pressure and diabetes. The lack of exercise might put the blood sugars out of control. So it is important that whatever exercise you have been doing before, you continue to do that at the house. And do it systematically and probably a bit more if it is possible, if you can do it. Because you've got all the time in the world now, and this is the time for you to utilize to improve your health. This is one of the important things that you can do it. Regarding the doctors who are at the, at the front line of treatment of these virus infections, it is slightly a high-risk area. And at least in some of the hospitals, including mine, the hospital authorities have been providing the personal protection equipment. So there you have class 1, class 2, class 3 protection. So I don't have to go into the details of it. Class 3 protection is the highest protection, wherein you wear 3 layers of protective gear. And class 1, you wear only 1 layer of protective equipment. These are all quite expensive, mind you. But then who is going to bear the expense? It is not the hospital, it is not the doctor. Ultimately, patient has to pay for it. So basically, it's going to be an expensive affair. It's going to be less, less intensive treatment because people are not going to see you as frequently as otherwise would have been had there not been any virus infections which is potentially infectious to the treating healthcare providers. So you have to pay more and get less. This is what it is, and that is the reality. Now, so basically now, although government has gone one step ahead by giving incentives of 10% more, salaries, but that's, is good that the government is recognizing that these doctors and healthcare providers are working, putting their lives at risk. At least that is the minimum we expect from the government agencies, and that's what they have done it. But then it doesn't take away the risk to the doctor. And can you ever imagine that in Hyderabad, around Kim's Hospital, a lot of junior doctors have been living in apartments as rents.
Yes.
Now the landlords are requesting them and tell them, please don't stay here. Now we have got a situation wherein more than a dozen doctors working in Kim's are forced to go out of their rental houses. Where do they stay? Is this what we expect from the civilized society? Now the hospital has gone out of the way to accommodate them in the nearby lodges, and then they have taken over some things and they are trying to accommodate within the special rooms of the hospital. But a civilized society wherein as doctors we are working at the front line, risking our lives, and we are asked not to stay next door to them. This is the height of absurdity. This is the height of, what do you call, I do not know what to say about these people. Their point of view is they are going to infect us. I said, you know, it is not going to spread by the environment or by the air. It's going to spread only by direct contact. Otherwise, you know, it could have caused a lot of havoc by this time if it is spreading only by atmosphere or by air. Be that as it may, these are the practical situations. I never thought Hyderabad will see that day wherein doctors are asked to vacate their rooms because you are touching an infected patient or potentially infected patient. But this is the reality. Who is going to come to our rescue? Although the government says we are going to punish them, who is going to complain? Who is going to take an action? Who is going to see that this punishment is meted out to them? But this is something that probably we need to think over. My sincere advice to these people is, after all these things are over, you should put up a board there. This house you should not enter as a tenant, because you people have not respected our work, our commitment to take care of sick people. If as a doctor I am kept out, who's going to take care of you when you fall sick, as and when you fall sick? If that is the way you are going to look at the doctors, then God forbid, if you fall sick, please don't go to the hospital. Please don't see any doctor. And let fate decide your outcomes. But this is what is happening in Hyderabad around Kim's Hospital. And hospital management has gone out of the way to accommodate these people, because they are the people without whom we cannot give any service to the patients who come there who are very sick. It is not only COVID patients suspected, because nobody says that he has got an infection. Whenever we are suspecting them, we are asking them to get the test done. And then if they're positive, we are asked to ship the patient to Gandhi Hospital, as things stand today. So basically now, this is what it is. And one more important thing, probably which not many people realize, is as doctors, we always carry a stet. And we are carrying the stet to see the patients. And most of the doctors, as I know it, as people carry the stet back to their houses. That means there is a potential danger of carrying the viruses, especially on your stainless steel, or what you call diaphragm of the stethoscope, is a place where the virus can stay for more than 3 to 4 hours. So my request to all the doctors is, leave your stethoscope in the area where you work. Don't carry them back to the houses. This is something that nobody has emphasized it, because I've been seeing lots of videos on the TV emphasizing, but it's very strange and very difficult for the people. One guy comes on the TV, doctor, and then says, masks have got no utility at all in this thing. And then the next person, he says, mask is the only thing that is going to protect you. Now, how do the common man takes all this information and then chooses? So he's going to choose whatever he's going to like it. It is not based on science. It is based on our beliefs rather than on science.
One more question
so
here,
anyway,
sir.
I think somebody has to take some time from one of these channels, local channels, and then have a scroll done once every 1 hour, saying that these are the precautions you should take. You should remind them. Wash your hands. Actually, what I have done in my house is, all people, irrespective of what you do or what you don't do it, whether you touch or not touch it, you have to go and wash your hands every 3 hours by clock. So we get up around 6:30, you wash as usual. But at 9:30, you have to go and wash your hands, even though you might have washed your hand around 8 o'clock because you had your breakfast. But still, I made it a rule that you should go and wash your hands every 3 hours, whether you do or whether you don't do it. Probably that's one of the simpler ways of decreasing the risk, if not eliminating the risk, of carrying the virus to the other persons in the house.
One more question here, sir. many doctors are
Yeah.
also having and many patients from the internet. So the ACE inhibitors. So you are a wide user of ACE inhibitors. In this COVID corona affected patients, should they stop, or preventively should they stop, or is a widely
Sure.
used antihypertensive?
Yeah, actually that has become a very controversial subject. And American College of Cardiology and American Heart Association and Heart Failure Society of America has said there is no evidence that these drugs increase the risk for development of COVID infection. The understanding was, or the suspicion was, usage of ACE inhibitors and ARBs may result, not will result, but may result in overexpression of ACE2 receptors, which is the link or which is the ligand for the virus. Now, so far there is no evidence that these things have increased the risk, although initially there was some concern saying that people who are hypertensive are at a higher risk for these outcomes after COVID infection. But everybody has been asking me, my way of looking at it is, if you are going to use ACE inhibitors and ARBs as a compelling indication, like in heart failure or in a diabetic nephropathy, then probably you should continue it. If you are not using it, or if you are using those drugs only as a second-line drugs for control of high blood pressure, probably it may be worthwhile changing over to a non-ACE, non-ARB, and use another drug which can effectively control your blood pressure. That's my take. Because there is no data till now which says either it increases or it does not increase. It is only our perception. There is no scientific data one way or the other. But common sense dictates that whenever there is a suspicion, probably it is better to err on the over side rather than on the lower side. So my take is, if I prescribe ACE inhibitor ARBs as a part of control of heart failure, probably I say, please continue the drug and then watch. If I prescribe the ACE ARB for control of blood pressure, I say you can change over to other antihypertensive drugs like calcium channel blockers, alpha blockers, centrally acting drugs, instead of continuing with ARB and ACE inhibitors. Do I have any scientific basis? I don't have any scientific basis, but this is, as I keep on telling to a lot of my juniors, don't put anything in front of common sense, not even science. So common sense should prevail first, and science only next to the common sense.
Thank you. Thank you, Dr. Dayasagar Rao garu. It was a very wonderful session, elucidating about the facts of the time. And I heartfully say thankful to you for agreeing to spend this time with us. And for further queries, anything, we will again come back to you, sir, at a later point of time.
Sure.
Thank you very much, sir.
By all means. Thank you.
Thank you, sir. All the best, sir. Thank you.
Sure.